What are the most common breastfeeding challenges?
I would say my baby is too sleepy. He keeps falling asleep at the breast. That's like the number one challenge. Number two question I get is, how do I know my baby's getting enough? The first question I would ask is, how do you know you don't have enough milk? Sometimes it's perceived low milk supply, and sometimes it's true low milk supply. So you do usually need a lactation consultant. If you are able to hand express and get colostrum before your baby is born, and you put it in those little syringes, you can order colostrum harvesting kits, and you just put the colostrum in your freezer. I think it's really good to bring that with you to the hospital. If your baby's at the breast and you're hearing these sounds, gulp, 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 they are really struggling to handle that flow. It is way too fast.
One breastfeeding must-have for every mom in hand.
Oh, a hand pump.
And
when I say a hand pump, I don't mean a Haka. I mean like the old school Medela, the one that you squeeze with your hand, is a must-have.
Hey guys, welcome to my podcast. Today we're going to be talking about something not related to real estate at all. This is something very close to my heart. I've done healthcare for a very long time, and today is for those moms that are having difficulty with breastfeeding or have questions on breastfeeding. We're going to be interviewing a lactation herself and a author who wrote this book, Naomi herself. She's very good, very professional, has lots of information. So I can't wait to get started. Let's go. Thanks, Naomi, for coming on our podcast. Guys, this is Naiomi Catron, an amazing lactation consultant, well known here in Austin, getting all over around I'm looking at. And Naomi, tell me a little bit about yourself.
Well, thank you for having me on your podcast. My name is Naomi Catron. I am a international board certified lactation consultant. But Reem and I got to know each other in the hospital because we were both registered nurses.
Mm-hmm.
I did labor and delivery and antepartum, and that's where we met. I think where you're doing postpartum.
Mm-hmm.
And I just, one of my patients kind of was like, you should start a lactation business. You're really good at lactation. And the kind of wheels got going, and that's how I got into doing lactation care. But yeah, I own a practice. I'm the founder of Milk Diva Lactation here in Austin. We do home visits, office visits, and virtual visits for lactation and breastfeeding care from all the way in Liberty Hill, and then we go down Georgetown, Cedar Park, Austin. We'll do Buda and Dripping Springs.
Mm-hmm.
And then I also have a chiropractic clinic that specializes in prenatal care, postpartum care, and pediatric care. And that's in our office in Far West, right there in the Arbor, like right by the ARC, there off Far West and Mopac. So that's a little bit about me. And I've lived here in Austin for almost 20 years.
Wow.
I have my kids are one's in college and the other one's about to go to college in a year and a half. So yeah, I did everything wrong. So I've learned now, oh, that's why that was so hard. I was doing it wrong.
No, you were amazing. So what led to, so how many years are you in as a lactation consultant?
Let me see, 6 years.
6 years. Okay.
Right. And labor and delivery I did for 10 years. And I got into this really because there's a big gap from when you leave from the hospital with your baby to when you go home. Like there's just like so much more that happens when you get home. Mm-hmm. And my experience, I feel like I had a lot of judgmental lactation care, and it was like breastfeed 100% or anything else. Like if you introduce pacifier or bottle, like that was kind of demonized. And also, it was just a one size fits all. And so I had difficulty breastfeeding, and I feel like the advice that I got wasn't very appropriate or customized to my situation with my baby. And so I just wanted to do things a little bit different. I wanted my patients to feel like they can make whatever choices they want and they would be supported.
Yeah.
And I really think it's important nowadays for people to have individualized care and not go to TikTok or Instagram for their breastfeeding care because it's so nuanced. Yeah. Every baby is different. Every mom is different.
Yeah. And, I want to get to know a lot more because me having twins was a whole different story. Even working as a postpartum nurse, you feel like you know everything. But yet when it comes to you being a mom and feeding your own kids, I don't know what it is. You just forget everything. You're like, what happened?
And it's just so different because you're like, oh, I don't know if I learned this exactly, or what do I do in this situation? It's not
exactly.
It's not like one answer doesn't fix all the things.
No. So that being said, I do have a lot of questions that are here that I want to write it down and ask you so we're not missing any important details that the consumers are asking. I'm not going to say clients. I'm not going to say patients. I'm just going to say people that are on social media. Yes, have asked me these questions. So first of all, let's start with your book. You just wrote a book. What inspired you to write that book, and who is it for?
Great question. So my book is called Milked, Finding Your Flow in the First Weeks of Breastfeeding. I have spent probably the last year and a half, maybe 2 years working on this book because I kept hearing the same thing over and over in our visits. We do thousands of visits per year because there's a group practice. There's 5 of us. And I often hear, oh, I wish I would have known that. Oh, I wish someone would have told me that. And the things that I was sharing weren't very complex or in depth. They were simple things that if people knew before they had their babies, it could really help them for success.
Yeah.
And so this book is meant for people who plan to breastfeed and are still pregnant. Because what people may not know is the first 2 weeks after birth is the most pivotal to how your long-term breastfeeding journey will look. And so if we kind of get things started off, it's like a little plant growing. And if it starts growing a little crooked, it's hard to get it to go straight. So we want things to start blossoming in the right direction from the beginning. But many times you get maybe not the most accurate information from your girlfriend or your sister who just breastfed because your baby might have been different. For example, if your baby comes early, or if your baby has jaundice, or if you have preeclampsia, or if you have diabetes, or if you had a stat C-section, that situation is going to look different than maybe your friend who's giving you advice that it's her 3rd baby and she had a 40-week unmedicated birth. So that's the first thing. And we want the moms to just feel successful and not be surprised.
Yeah.
So the book does talk about how to set yourself up for success that oftentimes is not discussed in a regular prenatal breastfeeding class because they teach you the vanilla story. When everything goes perfect and your baby just comes out and opens and latches and everything is bliss. But what happens when your baby is too sleepy to nurse or doesn't open their mouth wide enough or is born early? So this book is, yes, it covers some of the basics, but then more importantly, it covers all the things that no one else is going to tell you from the labor perspective, nurse perspective, and from the lactation consultant perspective, so that you're not like surprised. So you don't necessarily even have to know and master all the things, but there's a chapter like, oh, what if I had preeclampsia? Oh, what if my baby came early? Oh, what if my baby went to the NIC unit? What if I want to bottle feed? What bottle do I use? How do I incorporate that without messing up breastfeeding? So those kind of things that are really pivotal for you to be prepared, you and your partner to be prepared for before you have your baby.
So that's awesome. Some people can at least start reading the book, because I know when you have patients that come to the hospital, they're like, oh, we've done a breastfeeding class. We've kind of know what we're doing. But then when the baby comes out, it's a whole different thing. I was like, I thought you all had taken a class, but they can't remember.
They cannot remember. And I think the classes, it's like this. If you learn how to play a video game where they drive the cars, right? Are you qualified to go drive a car on the street if you've never done that before? So like your kids are young, right? They're not driving yet. And if they're like, oh, mom, I know how to do Mario Kart. Like, I'm good. I can drive. Are you going to be like, sure, you're ready to go drive on the street? Probably not. So it's the same thing when it comes to feeding your own tiny human. A lot of the classes might teach, like I said, how you do things when everything goes perfectly. But there's something even just about holding your own baby compared to holding a baby doll. There's just an emotional part. And then babies are squishy and they move and they like put their hands in the way, and the baby doll doesn't do that. And so it is important to have some hands-on help. But I also think prenatal classes teach the basics. And many times we don't fall in that vanilla category. Actually, at least 30% of births have some sort of thing that happens that's not in the vanilla category. And so how do you manage that? And I will say, in my experience, I feel like maybe less than 15% of patients take a prenatal breastfeeding class. I feel like a lot of patients take a prenatal birth class, but like birth is going to happen no matter which way you slice it within 24 to 48 hours, no matter what happens in the world. Breastfeeding, on the other hand, you spend hours and hours and hours every day for many, many months. And so we oftentimes skip over that class when I have multiple patients every week tell me, I wish I would have taken a prenatal class, because that's the gift that keeps giving, whether you like it or not. Like you have
No,
to
it's true. Absolutely.
keep figuring out the
Yes.
feeding thing 8 times a day at least.
Do you know if there's a link where they can find if they are interested in a breastfeeding class, or do you guys offer that?
We offer a breastfeeding class. We have one that's at a North Austin location and one that's at a South Austin location, and they're once a month. So my June class is already booked, like it's already filled for the North location.
Okay.
And so they would just go to milkdiva.com and they would look for prenatal class. And so that's totally easy to do. And they can also have a prenatal lactation consultation one-on-one. I think a group class is actually better though. And of course, coupled with the book, you would be very prepared for breastfeeding.
Perfect.
However, I do want to say, just like learning how to play Mario Kart doesn't make you prepared to go out on the street and drive, taking all the classes, reading all the books, even with parenting.
Yeah.
Don't you wish you just had someone there to tip, like, can you tell me how to hold, how to do this? How is it enough milk? How do I know my baby's like getting enough? And so never skip out on the prenatal class, but always just, I would say, get in with a lactation consultant. What I recommend is while you're still pregnant, like somewhere between 34 and 37 weeks, go ahead and book your postpartum appointment. Because all of us, if you're a good lactation consultant, you'll probably have a wait list.
Yeah.
And so if you call like, hey, it's Monday, I just had a baby today, can I have a lactation consultant on Wednesday? Come to my house. You're probably not going to get that because we have a wait list. So while you're 34, 35 weeks, go ahead and book it. Book your postpartum visit for 1 week past your due date. And that way you'll for sure have a postpartum consultant like ready to go when you're ready for it.
So you all don't go to the hospitals, it's after.
Correct. We do not go to the hospital. So you have lactation consultants in the hospital who will help you. However, I noticed that your baby really wakes up and is hungry and shows their personality like day 4 or 5. And you're already home by that point and you're like, oh my gosh, what do I do now?
Yeah.
He seems always like he's hungry every hour. He doesn't let me put him down. I don't know if he's getting enough. Is this normal? How do I know? So yeah, that's when I think like a week after your due date is a fantastic time to work with a lactation consultant.
No, that's perfect. And leading to postpartum, our next question is, let's talk about the first week of postpartum, right? What are the most common breastfeeding challenges?
I would say my baby is too sleepy, keeps falling asleep at the breast. That's like the number one challenge. And the next number 2 question I get is, how do I know my baby's getting enough?
Yeah.
And that is real life. I will tell you, I'm probably not going to give any like step, like you do this, then this, and that's how you get success, because it's very nuanced. And so helping your baby stay awake, I think what people should know is if your baby is born less than 40 weeks, the likelihood that he or she will have the stamina to exclusively breastfeed during those 2 weeks is low. There is a scoring tool that we use in the NIC unit called I can't remember the name of the scale now, but it is a scale that we will measure a baby's ability to exclusively breastfeed. It's called PIBS, Preterm Infant Breastfeeding Behavior Scale. And we look at things with how long they're able to stay at the breast, how many suck cycles, swallowing pattern. And until they score a certain number on this test, then they are not ready to exclusively breastfeed. And so babies who are born less than 40 weeks generally don't have the stamina to exclusively breastfeed. So hand expression, spoon feeding, syringe feeding, and sometimes bottle feeding along with breastfeeding is going to be something that is incorporated when you have a sleepy baby, because the risks of your baby not getting enough milk when they're early, like less than 2 weeks of life, is dehydration and jaundice, which can cause you to need to go to the ER, and we don't want that. So I think a lot of times people are surprised that a lactation consultant will tell you like, hey, let's feed your baby, let's supplement your baby with your milk, with your own milk. They're surprised, but it's very temporary and short-lived, because the more calories we can get in your baby, then they get stronger and they wake up and then they have the stamina. But if we don't ever give them the calories they need, they're going to stay being sluggish and sleepy and not wake up. And that's for a baby who doesn't have jaundice. Babies who are born of Asian descent do have a higher chances of getting jaundice. And right then and there, just because they're jaundiced, they're super sleepy. And supplementation. And when I say supplementation, I don't mean formula. I mean giving your breast milk to your baby from an alternate source, a spoon, a syringe, or a bottle. So I'm not sure if that helps to answer the question, but Sleepy babies are the number one thing. And then how do I know my baby's getting enough is the second question I get. The truth of that matter is it's a skill that is learned because you're listening for the suck swallow pattern and you want to make sure your baby looks satisfied. But in the first 2 weeks of life, how do I know the baby looks satisfied? If I've never had a baby before, right? I've never worked with a baby.
Yeah.
I'm not a nurse.
Yeah.
This is my first baby. How do I know the baby's satisfied and is sleeping or is hypoglycemic and sleeping? Or is jaundice and sleeping? It can really look the same. And so that's why it's important to have a well-qualified lactation consultant because we have a special scale. It's very expensive. We schlep around in our cars with us or in our office. It's almost $1,500 and it weighs your baby at accurate to 2 grams, so 2 milliliters. And so we will weigh your baby before they feed at the breast and weigh them right after. And we can tell you, oh, your baby's whatever, 5 days old, and your baby transferred 8 milliliters in 20 minutes. That's not enough. Or your baby transferred 46 milliliters, which is 1.5 ounces more or less, in only 10 minutes. Fantastic. And you see the milk is in the mouth, the baby looks happy. So we use that scale for the first few weeks of life to teach ourselves and teach the mom how to tell their baby's actually getting enough. And the baby has to prove to us that he or she can remove that milk by being weighed before and after these feeds. And they show consistency. And that's when we are able to kind of take the training wheels off and not have to weigh and not have to worry.
So you're saying weighing the baby's instant, like you're saying after feeding?
Before the feed, so we have a weight. Let's say your baby weighs 3,500 grams, or let's say your baby weighs 6 pounds even. And it has to be on a very accurate scale. So a food scale or like a baby hatch scale is not accurate enough. They're off by 1/2 ounce, and that's a lot. So you'd weigh them, and let's say they're 3,000 grams before they eat. Same clothes, same diaper. You weigh them after, and if they weigh 330 grams, you know they transferred 30 milliliters. And that's how we can, and based on how old they are, we can tell you that was sufficient or not sufficient. And then based on how long that took, because what if you took 2 ounces, but it took an hour to get? Well, there's a problem there. It shouldn't take that long. So that's where our specialty comes in, because we're looking at a lot of things to see how efficient and proficient the pair, and we call them dyads or couplets, are working together.
Okay. I know we talked about the sleepy baby phase and how can you know if they're taking in, enough supply. But what if for the moms that just don't have enough supply? Is there something that you can do naturally or whatever? What do you suggest for those moms? Because they're stressed, right?
Yeah. I was a low milk mom.
Yeah.
The first question I would ask is, how do you know you don't have enough milk? Sometimes it's perceived low milk supply, and sometimes it's true low milk supply. So you do usually need a lactation consultant to tell you it is for sure true low milk supply. So to give you an example, if you're pumping with the wrong pump, so if you're using one of those hands-free pumps that you just stick in your bra and you walk around the house, that might be the reason you have low milk supply, because it does not remove milk as efficiently as other kinds of pumps. The other reason sometimes people think they have low milk supply is because their baby wants to cluster feed in the afternoon, like between dinner time, basically. And they're like, oh my gosh, my breast feels soft. I don't have enough milk at that time. But in the morning, they're really, really full. Well, they might be surprised to know they make a lot more milk during 2 a.m. to 7 a.m. because you have high prolactin levels, and make a lot less milk from like 3 p.m. till about 7 p.m. because they have low prolactin levels. So it's not like you have a low milk supply. It's that you make more milk in the morning as opposed to the afternoon. And so we would make a plan to make sure we harvest some of that oversupply that you have in the morning so we can feed it in the afternoon. And then true low milk supply, people who are at risk for that are people who have had IVF, have any kind of fertility issues, any kind of endocrine issues. So diabetes, hypothyroid, I'm trying to think some other things, have had a breast reduction. That's a big one. They are a higher risk for having a low milk supply. People who were not able to latch their baby or remove milk effectively in the first 72 hours of life also have risk for low milk supply. So in that case, the best thing to help improve milk supply is frequent and effective milk removals. And I say it like that on purpose, because I don't say frequent pumping and I don't say frequent breastfeeding, because your baby can breastfeed 12 times a day, but if they're not effectively removing milk because they're preemie or they have a tongue tie, that's not going to help your milk supply. And if you're pumping 12 times a day, but you're using the wrong pump, that's not efficiently and effectively removing milk. So the best way to increase milk supply is frequent and effective milk removals. And when I say frequent, we're about, I would say at least 8 times per 24 hours. Things like the lactation cookies and lactation tea, I would not spend my money on.
Okay.
So lots of skin to skin with your baby and frequent and effective milk removals. And if you have a good lactation consultant, they should have like all the different size flanges and be familiar with lots of pumps and help you find a pump and a flange fit to maximize milk removal. And I have a podcast on it also. Like I have a whole episode on flange fitting and pumps and bottles that people can look up just by looking up Milk Diva in their...
People might not even know such
I
thing.
did not know.
Yeah.
The pump comes with a size 24 and 28, and most people are a size 15.
Wow.
So it's like walking around Disneyland in a size shoe that's 3 sizes too big for you. Like,
no, that's not going to work.
Not going to be that great.
Yeah.
You're not going to get sufficient milk, and you could have discomfort with pumping if it's the wrong size.
No, that's true. And then another question that I had was, can they start pumping earlier before birth?
Great question. And tell me what the person's, is that to help with increasing milk supply?
Yes.
Is that okay?
Yes.
We call it antenatal expression. Pumping before your baby is born, we have to be a little bit careful because we want to make sure you're not at risk for preterm labor.
Yes.
So as long as no one said to you, hey, you have a shortened cervix, or I'm concerned you're going to have preterm labor, then that could be totally safe, but you want to talk to your obstetrician first. We generally are not going to do while you're still pregnant pumping before 37 weeks. So usually around 37 weeks, it's safe. What we find to be better than pumping is learning how to do hand expression, because what will happen in those first early days is you don't really have hardly any milk. They're just like little drops, and they get stuck inside the pump part, so you can't get them out. But truthfully, pumping before your baby comes doesn't really help increase your long-term milk supply, but making sure the placenta is fully out of your body, because any kind of placenta pieces left behind will decrease your milk supply. And it's within the first hour of birth, getting the baby latched is really important. So frequent and effective latching sessions or pumping sessions after your baby is born is going to be probably the best thing to do.
Okay. Well, thank you for that. And then when the babies are born, there's a best time to latch. They're really active, they're awake, and then they start falling asleep. I'm just talking about the phase. Now, another question that I have a lot is they're pumping, right, in the hospitals. They've got great milk, right? When they're home, they have a lot of milk. So about storing or room temperature, how is it good for? Can you talk about a little bit about that?
Yeah, I do have that in the book. There's like a whole chart.
Perfect.
And on the back of the book, you have like a QR code that you can get access to all these resources. So after the book is done, it's not just done. Then it's like, oh, you scan this QR code and you get access to all these like really cool guides and cheat sheets. And one of the cheat sheets is storing milk storage. And so breast milk storage and formula milk storage are going to be different. But breast milk, believe it or not, is good at room temperature for the minimum of 4 to 6 hours. And so you could pump and you can leave it on the nightstand. And as long as you feed it to your baby within 4 hours, it's totally fine. Otherwise, if you plan on feeding it the next day, go ahead and put it in your refrigerator. Breast milk is good at in the refrigerator for 4 to 6 days. So that's kind of the cool part about breast milk. When it comes to freezing breast milk, there's a little small nuance I want you to know about. Some women have a enzyme called lipase, and it can change the flavor of the milk once you've frozen it. So sometimes I'll have someone call me and say, my baby's refusing their bottle all of a sudden. And the first question I'll ask was, did you give them fresh milk or frozen milk? And they'll say frozen milk. And so usually that's because the milk changed flavor. So before you start feeding your freezer, which I don't really believe that we need to have a lot of milk in our freezer when you just have one baby, I do want you to take your fresh milk, smell it, taste it, and then stick it in the freezer. And then smell it, taste it, and make sure it does not have a strong soapy or metallic flavor or smell. If it does, you're a person with high lipase, And I would not recommend that you start freezing all that milk because there's a high likelihood your baby will refuse it. And so you're going to want to talk with a lactation consultant to find out another method to prepare to go back to work, because freezing milk a month ahead of time is not going to be the right fit for you because it's just going to taste nasty and your baby won't want to drink it. So those are some of the nuanced things that people don't realize. You don't know what you don't know. So you don't know you need the help of a professional if you didn't know that could be a problem.
Exactly.
So before you freeze your milk, I would just say test it to make sure it doesn't change flavors. Otherwise, breast milk is good at room temperature. And I say room temperature, I mean like air-conditioned room temperature, 4 to 6 hours and 4 to 6 days in the refrigerator.
Yep. And then freeze it. And then if you want to keep it out, please do not put it in the microwave anymore.
Do not put it in the microwave. Don't mix it like with other old milks either. So it has to be, if it touches your baby's mouth, like we need to use that. There's some variance there, but to be super conservative, I'm going to say within an hour. But we're not holding that milk that your baby sucked on at 9 a.m. and you're not going to give it to them again at 4 p.m. or 2 p.m.
Don't do that. Now, it's talked about a little bit about how to increase the supply, but what about for women that have oversupply, forceful letdown? They don't, we don't get talked about enough about that. What should moms know about managing that?
I think oversupply and a forceful letdown is the hardest thing to overcome. So people always wish for a robust milk supply, but I'm going to tell you, having an oversupply, you can actually cause yourself. So if, let's say in the hospital, sometimes they say, I want you to feed your baby from the breast and then pump and then bottle feed. And that advice is fine for a week. But if you do that for a month or two, you're going to have milk for twins.
Yeah.
And you cause yourself an oversupply. So please be really, really careful. In this case, more is not better.
Yeah.
So if you have if your baby seems to be, so I'm going to be silly for a second, you're going to hear some sounds, but if your baby's at the breast and you're hearing these sounds, gulp, 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 they are really struggling to handle that flow. It is way too fast. So one of the first things you can do is ensure that your positioning when you feed your babies, head is here and feet are down here. I don't want them way across like this, because if you were drinking on your side and someone squirted a bottle of water down your throat, it's going to go to the back of your throat and you're going to want to cough. It's going to be hard to manage. But if you're on an incline, on a slope, it'll go down the right pipe and it'll be easier to swallow. Sometimes hand expressing into a towel when your baby starts to, because their eyes get really wide and then they start gulping, and then sometimes they pull off and they'll start coughing. When that happens, just put your baby to your side, hand express or use a hand pump, get a little bit of that spray to slow down, and then you can put them on the breast. Oftentimes you'll have that gulping and that really difficult fast letdown in the morning when you have all that extra milk. So you're going to want to work with a lactation consultant to make sure that there's not something you're doing to cause an oversupply, and that she can try to help you slowly and safely get milk just for your baby. And there's some other techniques to do that. But I would say leaning back when you're nursing, or nursing in a laid back position in your bed, and then having your baby's feet below the head in your nursing position. And maybe the third thing would be hand expressing when the baby starts gulping and really struggling with that volume would be the top 3 things I would recommend. There's some more steps to help with that, but I think they would need the help of a professional, because I don't want this to be more like a TikTok clip where people are just trying random things at home and then accidentally maybe lowering their supply too much.
Yeah. No. And then leading to the next question with oversupply, but how do you guide moms through painful issues like mastitis, clogged ducts, or nipple trauma?
So all of those things, the first question anyone should be asking you is trying to figure out why that happens, getting to the root cause. Because people don't just wake up with mastitis. There's something happening. Maybe we were pumping a bunch and then all of a sudden we stopped pumping and just breastfeeding, and maybe the baby's not removing the milk efficiently. Maybe an accident, your baby slept for 9 hours and you're used to them waking up at 4 hours. So you have all this milk. And so what people don't realize is there is infectious mastitis that needs antibiotics, but then there's inflammatory mastitis that does not need antibiotics. So your consultant should be able to ask you a series of questions to determine if it's infectious or inflammatory. Usually if it just happened, it's inflammatory and we can treat it without antibiotics. And that includes regular feeding. So regular milk removals. You're not increasing your milk removals, but just regular milk removals. Ice, ibuprofen, those are like the top, or Tylenol, ibuprofen or Tylenol. And within 24 to 48 hours, those symptoms should be resolved. If you're getting recurrent mastitis, there's something else going on here. What is going on? So we'll need to investigate that further. So generally with my patients, we're doing all the things to help them prevent getting these things. We try to be proactive as opposed to reactive. That's what I mean. That's why it's so important to have a lactation consultant in your back pocket while you're starting this journey, because you cannot just call a clinic and be like, oh my gosh, I have mastitis. I need to see you today. That's not going to happen. And so when it comes, usually the precursor is going to be clogged ducts come first, and then something called milk blebs, which is white, almost looks like a whitehead on the actual nipple. So clogged ducts and milk blebs, and then mastitis comes later. And all of those things are very much related to oversupply. So one thing that is very helpful, that could be helpful, are some supplements to help reduce clogged ducts, to be used on a temporary basis. So sunflower lecithin is a great supplement. You can get over the counter. You can get it at the HEB. It doesn't need to be a fancy brand, but using that temporarily while you're getting clogged ducts feel like an M&M under the skin. And it's okay if you have a little lump, and then if your baby feeds or you pump and the lump gets soft or goes away, you're fine. No problem. No need for intervention. But if the little lump is getting bigger and not going away, we need some help, and you want to get a lactation consultant in there. But in the meanwhile, taking lecithin, it comes in 1,200 milligram capsules. Taking that 2 to 3 times a day, as long as it's okay with your provider, would be what my starting point would be. And any recommendations after that would really have to be evaluated based on your individual case. When it comes, if you think you're getting mastitis, remove milk regularly. So don't go 5-6 hours without removing milk. Ice packs to the breast, 20 minutes on and off, and then Motrin. And you want to make sure you're checking your temperature, making sure your fever's not increasing. You want to make sure after 24 to 48 hours there's no signs of fever. If not, you need to call your doctor.
Great advice.
There's a website called The Physician's Guide to Breastfeeding. Dr. Katrina Mitchell, who I mention in my book, and I have all her recommendations in my book, is a great resource for any providers or doctors who are listening to this, so they can be up to date with the newest recommendations for treatment of mastitis, because the mastitis protocol changed in 2022, I believe, and not everyone realizes the change to treatment or medication.
Wow. So we've talked about oversupply, undersupply. But what do you say when a patient is just like, I've had terrible time with breastfeeding with my new baby. I just don't want to do it. I don't want to do any breastfeeding. What would you say them to for no stimulation? Like what is your advice on that?
For milk cessation?
Yes.
I totally respect that decision. And sometimes that decision is the right decision. It depends on how robust their milk supply is. But generally speaking, is slow. We don't just stop breastfeeding or we don't just stop pumping. So if the person at that point was pumping or breastfeeding 8 times a day, but for some reason she's like, I'm over this, we would slowly take it from 8 feeds or breastfeeding sessions down to 6, down to 4, while taking sunflower lecithin and maybe some probiotics to help with breast health, while using ice. While in the old school days, we would use cabbage. But I like cabbage cream. There's a product called Cabo cream.
Oh.
I love it. It's fantastic. Wow. I would get extra strength Cabo cream. It smells so good too. And you would apply that to the breast every 4 hours, along with ice, ibuprofen, and then little by little reduction of milk removals. That's like the very generalized approach. Depending, like I said, how robust their milk supply is, we might need to incorporate things like Benadryl or Sudafed.
Perfect. And now another question a lot of them ask is, they're scared to use a pacifier, right? Would that interfere?
Great question. I think my podcast episode 2 and 3 are all about pacifier use. And I actually interviewed the inventors of one of my favorite pacifiers, which is the Ninny pacifier. And they're 2 ladies out of St. Louis. And I do love their pacifier, but it's we use it for therapeutic purposes, teaching babies how to suck properly at the breast. And so this is what I want everyone to know, is in the hospital, you're going to have a form when they come in, and it's going to ask you, is it okay if your baby has a pacifier anytime during painful procedures or never? And so what I want you to know is sucking is a way that babies soothe themselves when they have pain. So your baby will have a blood test in the hospital. It doesn't feel good for them to get poked. You used to do the newborn screen.
Yes.
Pacifier use for a painful procedure is totally appropriate. It's not going to affect breastfeeding. However, what oftentimes happens is your baby, when they're first born, doesn't get full feed, so they want to nurse like every hour. And so you put the baby to the breast and you feed them, and then you put them down, and a half hour later they're hungry again. And you're like, there's no way you could be hungry. So then they give a pacifier.
Yeah.
That's where we go wrong, because really your baby was hungry. So you gave him a passy, and we missed the opportunity to remove milk again from the breast. So that means your brain is like, oh, we don't need that milk. So right then and there, you lower your milk supply. And then on accident, you give your baby a passy, they use up all their energy sucking on the passy, and they miss a feed. So that's really where the negative loop comes in. If you're always offering the breast first and you're making sure your baby is milk drunk, and let's say you're like, oops, I forgot to change a diaper. I need to change a diaper, and she loses her mind and she needs to be soothed. That's when a pacifier would be appropriate. So we use pacifiers in a soothe and remove fashion. So if your baby is sucking on this pacifier, like she's trying to suck the color off the pacifier, she's still hungry.
Yeah.
But if she's just sucking on the pacifier 2, 3, 4 minutes, and then she falls asleep, passy pops out of her mouth, you put her down and she's content, perfect use of pacifier.
Fine. Okay. Thank you for that great advice, because a lot of them are confused on should we use a pacifier or should we not, right? Now let's talk about women that are going back to work, right? What's your take on returning to work while breastfeeding? How can moms prep for pumping and staying consistent?
Make sure you have a pump that matches your needs.
Okay.
So if you're an oversupplier, you might get away with one of those hands-free pumps. That might work well for you. But if you're a just enough person, you're going to need a double electric, like the kind that you pour it around and you stick in the wall, and you're going to need the flanges that are ugly, but they work better, right? So that's the first thing, is make sure that you have the best pump for you.
Yeah.
And a lactation consultant can help you with that. And the best fitting flange too. Once that happens, I like to tell my families, the ones who've tested their milk for lipase, 1 month before you go back to work, I just want you to add 1 pumping session and store that milk. So if you store 1 pumping session per day for 4 weeks before you go back to work, you're going to have plenty of milk before you go back to work. So you don't need, like what you see on Instagram, people have these full freezers. You don't need that. You're just asking for a heartburn at that point, because your electricity will go out. Your baby won't take the milk. You're just, something's going to happen, and your power is going to be compromised, and you're going to lose all that milk. Inevitably, that's what happens. But all you really need when you go back to work is, if you have like 10 feeds, 12 feeds, 15 feeds in the freezer before you go back to work, you have plenty. So if you think about it, if you're doing 1 feed and you're putting it in the freezer, so that's 30 feeds. So the way I'm telling you to do it is 1 month before you go back to work, you freeze 1 feed per day. You're going to have plenty of milk for you to go back to work, because I'm giving you way extra milk than you need, because you might be stressed when you go back to work.
Oh, yeah.
And the stress might make your milk go down for a week or so. And then you get it back up because you'll work with your lactation consultant. And then you got your mojo, but then you get your period. And then your milk will go back down. And so the plan that I'm recommending, getting 1 feed per day, 30 days before you go back to work, will give you plenty of buffer for both of those things. So that's my recommendation for people who go back to work.
Perfect. And we've talked about moms and babies. Let's talk about fathers. How can they involved in helping with any of this, right? With breastfeeding or,
I think one of the things that's really important is for dads to be involved in the prenatal breastfeeding class and in the lactation consultations, because a mom, I feel like we're really sleep deprived, and where our mind can be thinking about 10 different things at one time. So the dad is going to be able, because we're going to get panicked. We're going to go home and be like, oh my gosh, I'm trying to latch, but it's not working exactly the way it did when I was in the office. And the dad can be the calming force to be like, well, remember what the consultant said? Hold the breast like this. Or remember she said, put the pillow under the pillow. Or she'll be able to help with that. So if they're hands-on in that method, if they're in charge of taking notes when they go to the pediatrician's office, when they're with the lactation consultant, they can be the one in charge of taking the notes. Of course, if they can be the one changing the diapers and washing bottles or pump parts, that would be really helpful. This is going to be something that you may not expect lactation consultant to say. I think it's really important for dads to be able to be involved with the feeds. So I would say after somewhere between 2 and 4 weeks postpartum, I do like to see the dads giving 1 bottle per day.
Yeah.
And that is a really nice bonding time. It's not fun for the dad to get all the like gross work, like the diapers and just washing the stuff. The dad wants some cuddle time with the baby. I think dads can do skin to skin really nicely. So contact naps, skin to skin, taking notes for the parent while they're in their pediatrician appointment or the lactation visit. And then even a little bit more before, being the mom's advocate when the baby is born and going to the nurse's station every morning and say, hey, don't forget about us. We want to see a lactation consultant today. Like the dad to take that initiative and advocate for the mom is going to be really important.
Yeah. Or I think you just mentioned also let them do a bottle feeding while mom is pumping on the side if it's needed to be. Let them get a little bit more involved because as a mom, we both know, we've seen patients ourselves who've given birth, had kids, we're exhausted. So
you're exhausted. You are totally exhausted. And you can't, of course, you know, I don't mention the obvious things like making her a meal, making her a protein shake. Like those are kind of, I think, already obvious things. But yeah.
Giving her a massage.
Right. Like it's very, what's the word? Self-sabotaging. You really doubt yourself a lot. So you need to have a cheerleader.
Yeah.
You don't need someone else who needs to worry about their feelings and how they're doing. You really need someone to come behind you and like build you up. Yeah. It's a very anxiety-provoking experience.
Yes. Or just remember when's the next feeding. That's all, right?
Right.
It's simple stuff.
Yeah.
Quick question. When they're about to give birth, what are the few things you recommend for moms to take in the hospital?
That's a great question. I'll tell you what you don't need. You don't need your breastfeeding pillow. You don't need your pump. You don't need any of that stuff. I think what's really nice to bring, because you don't need a lot in the hospital, if you are able to hand express and get colostrum before your baby is born, and you put it in those little syringes, you can order colostrum harvesting kits, and you just put the colostrum in your freezer. I think it's really good to bring that with you to the hospital. Oh. Bring it in a freezer bag, because if you put it in the hospital refrigerator, I think they'll only allow it to be in their refrigerator for 24 hours. And colostrum will last in a freezer bag for a long time. So if you're able to harvest colostrum, bring your own colostrum. Let me think what else. I would say if they're gonna ask you about the poops and the pees, right? And so there's a paper you can do that, or you can just come prepared with an app. There's a really good app called Huckleberry. So you're gonna have to track your own baby's poops and pees and feeds. They're gonna ask you all the time. So colostrum, a little freezer bag, maybe the app to track the pees and the poos. When it comes to infant feeding, you really don't need much. If your baby's coming a little bit early, I would recommend bringing your own bottle. Okay. And I do have bottle recommendations. I can actually put the link to my Amazon store in there, which has like the pumps that I like, the bottles that I like, all of that. So if your baby's coming a little bit early, you know, you're probably going to be recommended to supplement. And so using your own breast milk or formula, but I would like them to use a certain shape bottle nipple. And if you don't remember that, no problem. We can fix it when you get home. Yeah. So I really don't think when it comes to infant feeding, even if your baby needed supplementation, they're going to provide all that in the hospital. It has to be sterile. You know, so they're going to have everything for you to feed your baby in the hospital.
So just don't stress out.
Yeah,
just forget everything. That's fine.
You really don't need a lot of stuff. Bring yourself. Bring some. You know, like you want to have slippers. Like I wear slippers like when I'm going into the hospital shower or whatever. So more of that thing, but you don't need pillows and breastfeeding pillows and your pump. The more stuff you bring to the hospital, the more hospital germs they get on them. So I'm just like, less is more at this point.
Okay. Well, those are great information that you provided. Thank you. Leading to a rapid fire question.
Yeah, I didn't practice this that much. So
yes.
Hopefully I'm ready.
So, okay. One breastfeeding must have for every mom in hand.
Oh, a hand pump. And when I say a hand pump, I don't mean a Haka. I mean like the old school Medela, the one that you squeeze with your hand, is a must have.
Okay.
It's very good.
Favorite go-to snack for nursing moms?
Greek yogurt.
Greek yogurt.
Yes, has calcium, has protein in it. It's usually fine for people who are lactose intolerant.
Random question. How many more calories would they need to take?
About 200 to 400, depending on how old their baby is.
Most surprising thing about breastfeeding you didn't know until you were in the field?
I didn't know about something called insufficient glandular tissue, IGT. If you have that, your breast shape, it's just a different kind of a shape, and just having that shaped breast puts you at a predisposition for low milk supply. I had no idea.
Oh. Okay, what song, mantra, or quote you live by during your days?
During my days, when I have tough days, usually it's on the business owner side of things, which this will be applicable to your whole audience, especially if you're in real estate. My husband shared this song with me, and he's in real estate, and it's not a popular artist, but it's a Damon Johnson, the guy from Shark Tank.
Yes.
Okay,
yes.
And he has a song called Boss Up.
Yes.
And I just listen to Boss Up when I'm having a bad day.
There you go.
Like, just reminds me.
Everybody needs it.
Yeah,
something.
it's totally, I don't know why. It helps me have a total mindset change,
Okay.
and I can do anything after that.
That's all you need.
Yep, Boss Up.
Boss Up. Okay, so if anybody wants to reach you, I'm going to have them provide link, but is there any other way?
Milkdiva.com would be the best way to go. And just remember, we're a group practice. So depending where you live and what your needs are, you can see any one of us. I've trained all of the ladies, and they are all A+ consultants. And if you need chiropractic care, it would still be milkdiva.com. And then you can find the book on Amazon or Barnes & Noble or anywhere you buy books. And then on Instagram, just look up Milk Diva. Facebook, just Milk Diva. So yeah.
Well, great.
Oh, and the podcast, I forgot to tell you, if they wanted to learn more about the flange fitting and all that, in their podcast player or on YouTube, they would type, it's called The Boob Business with Milk Diva. So I'm sure if you type in Milk Diva, it'll come up as well.
It'll come up as podcast. So if you guys want to listen to more in depth of, this was just the basic stuff we talked about, but if you want to get into everything and anything about breastfeeding, listen to all of your podcasts. Great information. Again, thank you for coming by and just giving us a little bit about what breastfeeding and talking about your book.
I appreciate you having me. It's been wonderful. It's been nice to see you and how you're blossoming. It's been amazing. You're such a rock star.
Thank you.